Welcome everyone. This is Dr. Wanda here from the Medical Paraclete, celebrating Cervical Cancer Awareness Month this January. I lost a beloved grandmother to cervical cancer. She was a smoker and only visited doctors when she felt sick. She left many adult children and grandchildren to grieve for her. Cervical cancer is the third most common cancer in women worldwide, and it remains a leading cause of cancer-related death for women in developing countries. In the United States, cervical cancer is relatively rare and has declined steadily over the past few decades. Signs and symptoms of cervical cancer include abnormal vaginal bleeding, vaginal and pelvic pain or discomfort, malodorous discharge, dysuria, also known as painful urination, postmenopausal bleeding, leg pain, painful intercourse, and fatigue. Human papillomavirus infections, also known as HPV, include a group of skin conditions commonly known as warts. They affect various parts of the body. Genital warts are the most common and the most contagious of them all. It spreads via skin-to-skin contact. There are greater than 150 serotypes of HPV, and the serotypes most associated with cervical cancer are numbers 16, 18, 31, and 45. As we said previously, genital warts are highly contagious lesions. Most are flat, small, cauliflower-like, or some have small stem-like protrusions on the scrotum, penis, vulva, vagina, cervix, and/or the anus. Treatments include topical anti-tumor medications that can be applied directly on the warts to treat them. These include salicylic acid, imiquimod, Podoflox, and trichloroacetic acid. Medical procedures are also used sometimes, and they could include electrocautery, laser therapy, and sometimes chirotherapy. The connection between HPV infection and cervical cancer is that an HPV infection must be present in order for cervical cancer to occur. 70% of all cervical cancers are caused by the following: HPV 16 and HPV 18. The HPV viruses produce proteins known as E7 and E6. E7 and E6 interfere with cell functions that normally prevent excessive cell division. This causes the cell to grow in an uncontrolled manner. HPV is sexually transmitted and is very common. In most women, HPV infections resolve on their own and do not cause cancer. However, there are factors that may promote chronic HPV infections in women. It can include a weakened immune system, such as the case with HIV infections, other STDs such as chlamydia, smoking, multiple births, long-term use of contraceptives, sexual activity at a young age, having multiple sex partners, and having promiscuous male partners. It's important to note that in women with HIV, there is a 5-fold increase in cervical cancer as compared to women who do not have HIV. And that statistic, unfortunately, has not changed in light of the use of highly active antiretroviral therapy. Routine screening is done with the use of a vaginal speculum, a brush, and a spatula to obtain samples of the cells from the endocervical canal. It is then placed in a liquid preservative and sent for cytology reading in the lab. Screening includes a Pap test and sometimes may involve DNA screening for HPV. The screening recommendations are: if you're less than 21 years of age, no screening is recommended. if you're 21 to 29 years of age, a cytology test, a plain pap smear alone every 3 years. Age 30 to 65, human papillomavirus and cytology co-testing every 5 years is preferred. However, they will take pap alone every 3 years. For women over 65, no screening is recommended if there's been adequate prior screenings and they haven't had any issues at all with high-risk indices. These recommendations are based on guidelines from the American Cancer Society, the American Society for Colposcopy and Cervical Pathology, and the American Society for Clinical Pathology, U.S. Preventative Services Task Force, and the American College of Obstetricians and Gynecologists. On the screen below, you're going to see the progression from normal to cancerous cells on the cervix. They are classified as they become more abnormal as CIN 1 to 3, cervical intraepithelial neoplasma or dysplasia. As you can see, the cells become more and more abnormal. If your test is abnormal, it is normally repeated in 6 to 12 months. If it continues to be abnormal, sometimes additional testing will be performed. But usually, mild dysplasia will resolve on its own, and only a follow-up pap test is necessary to confirm that it is indeed restored back to normal. If you should be diagnosed with cervical cancer, the treatments include surgery, radiation, chemotherapy, or a combination of several of the above, depending on the severity of the disease. Let's talk about HPV in pregnancy. During pregnancy, changing hormone levels can make warts grow faster than usual. A pregnant woman's body also produces an increased amount of vaginal discharge, which gives warts a warm, moist place to thrive. HPV, however, should not pose a risk to your baby. Warts don't need to be treated unless they're especially large or bothersome. If this is the case, your doctor can safely remove them by freezing them off with liquid nitrogen, which is called cryotherapy, with laser therapy, or using a heated needle called electrocauterization. They can perform surgery, and sometimes they can just make a small incision. Having genital warts shouldn't affect your delivery. Sometimes large warts may cause bleeding during delivery. Rarely, genital warts can grow large enough during pregnancy to block the birth canal or make childbirth more difficult. If this happens, your doctor will likely recommend having a cesarean section. While you're pregnant, if your pap test shows that you have precancerous cells in your cervix, your doctor may wait to treat you until after you deliver. Once your baby is born, you'll likely have another pap test done, and HPV often clears up without any treatment. If you still have abnormal cells after delivery, your doctor may treat you by removing the abnormal tissue with one of these procedures: cryosurgery, which involves using extreme cold to freeze off the abnormal cells; a cone biopsy or conization, which involves using a knife to remove a cone-shaped wedge of tissue; loop electrosurgical excision procedure, called the LEEP procedure, which involves removing your abnormal tissues with an electrically heated loop. You may pass HPV to your unborn baby during pregnancy or delivery, but it's unlikely. Most babies who do develop HPV in the womb will clear the virus on their own without having any long-term problems. In rare cases, however, genital warts may be passed on to the baby. Warts might develop on the newborn's larynx or vocal cords. And when those warts develop there, it's called recurrent respiratory papillomatosis. Treatment involves surgery to remove those growths. HPV shouldn't stop you from breastfeeding. Although the virus can pass from the mother to child in breast milk, This kind of transmission is very rare. According to the CDC, the HPV vaccine hasn't been shown to have any negative effects during your pregnancy. However, data is limited on vaccination during pregnancy. Therefore, they have recommended postponing vaccination until after pregnancy. Let's talk about the vaccination guidelines for HPV. The older guidelines recommended the HPV vaccine Gardasil for females between the ages of 11 and 26 and for males through age 21. However, the current guidelines now state that both men and women between the ages of 27 and 45 who have not previously been vaccinated for HPV are now eligible for Gardasil 9. The complete vaccination series involves 2 or 3 doses. 2 doses are recommended for most patients before their 15th birthday. The second dose should be given between 6 to 12 months after the first dose. 3 doses are usually recommended for anyone who gets their first dose between ages 15 and 26 years of age, or for anyone with a compromised immune system. You need to get a complete series of vaccinations in order to be fully protected. If you didn't get vaccinated before becoming pregnant, or you started the vaccine series but didn't finish it, you'll need to wait until after giving birth to get or complete the vaccine. The guidelines don't recommend the HPV vaccine for pregnant women. I think we all know the best treatment is prevention. Here are some prevention tips. Talk to your doctor about treatment for warts. Avoid high-risk sexual behaviors. Follow screening guidelines. Consider HPV 9 valent vaccine for preteens to young adults, age 26. And let's not forget the new guidelines that allow adults up to 45 years of age to receive the vaccine as well. There are some natural home remedies to help with HPV infections. I'm going to discuss a few right now. One is tea tree oil. Along with other health benefits, tea tree oil has been studied for use as an antifungal agent. The Mayo Clinical and Health website states that it may be useful against genital warts as well. You can apply a drop of diluted tea tree oil, where you mix 1 drop of the oil with a drop of, or 2 with a carrier oil such as coconut oil, and place it directly on the wart. And the wart should begin to shrink in size over the next several weeks. Green tea has also been found to be effective against cervical cancer, HPV, and genital warts. Green tea extract is available by prescription as an ointment called Cinecatechins, or the name brand is called Verigen. It's available at all major pharmacies. Verigen ointment is used to treat genital and anal warts in adults. This medicine is for use only on warts outside the genitals and around the outside of the anus. It is not for use inside the vagina, cervix, rectum, or urethra. Before using Verigen ointment, tell your doctor if you have HPV, HIV, or AIDS, or a weak immune system from disease or medication such as steroids. If you've had recent chemotherapy, radiation therapy treatments, or are pregnant or breastfeeding. This drug is a category C, and it is not known whether Verigen will harm an unborn baby. It is not known whether Cinecatechins are passed into the breast milk or if it could harm a nursing baby. Also, do not give this medicine to anyone under 18 years of age without first speaking to your doctor. Garlic has antiseptic, antibacterial, and antiviral properties. Additionally, it is well known for its ability to boost the immune system, and as a result, you can use garlic extract externally by applying it directly to the warts or by soaking gauze pads in a mixture of garlic and oil before applying and letting it sit on the warts. I love apple cider vinegar. Apple cider vinegar may treat genital warts at home, and it's similar to prescription medications that use acidic ingredients to kill off the virus. For example, the acidity in apple cider vinegar degrades the virus's DNA and the enzymes. You can soak a Q-tip, cotton ball, or gauze in apple cider vinegar and apply it to the warts. Who would have guessed? Vegetables are good for you in a number of ways, but they also contain antioxidants, fiber, plant sterols, and nutrients that promote the elimination of toxins from your body. Try eating crunchy vegetables like cabbage, broccoli, Brussels sprouts, cauliflower, and kale. These vegetables contain indole-3 carbanols, which can help clear up genital warts. It's recommended that you eat 4 to 5 servings of veggies a day. Folate and B12 research indicates there's an association between folate and B12 deficiency and an increased risk of contracting HPV infection. Multivitamins containing folate and B12 may help your body fight off an HPV infection and clear up warts. In conclusion, there are certain dietary and lifestyle supports that can help to reduce the strain on your body. Keep in mind that having genital warts is not a sign of poor health. However, you can also make some changes to your diet and other lifestyle habits to help your body cope with the symptoms of HPV. There is no scientific evidence that any food causes or cures HPV, but there have been studies linking a diet high in processed food and unhealthy saturated fats with recurrent HPV infections. Although a healthy diet cannot cure genital warts, it can still improve your body's immune system and your overall health. If you liked our video, please like, share, subscribe, and leave a comment below. We'd love to hear from you. Thank you so much for joining us today. Bye-bye.